And we'll give you a list of all those winners tomorrow right here on AM News at 10 o'clock. Now, in the last 3 decades, countries' blockbuster prescription medications for a host of chronic ailments have become available as generics. However, some people still believe that more affordable medications means skimping on health. And several studies found that generic substitutions may be associated with a powerful phenomenon known as the nocebo effect, where patients are convinced that a medication disagrees with them, that they start experiencing reduced efficacy and have imagined side effects. Now, this possibly explains why switching from a brand name medication to a generic version may cause people to report more side effects, even though both medications are chemically identical. Nicole Jennings is the spokesperson of Pharma Dynamics, and she joins us in studio for more insight on this issue. A very good morning to you, Nicole. Thank you so much for joining us.
It's an absolute pleasure. Thank you.
All right, so let's start with this. We hear about placebo effects, but today we're talking about the nocebo effect. What does that mean?
Yes, so if you think about the placebo effect, generally that would be people imagining positive effects from the drugs that they take. The nocebo effect, in a way, is a little bit the opposite. So if you imagine being switched from a brand name medication to a generic drug, and all of a sudden you don't experience the same efficacy, or you start to think that you have different side effects that you didn't experience on the originator. And the reality is that a generic drug is bioequivalent to the originator. So it is as safe for you, and it should be as effective for you to take a generic drug. Very interestingly, the American Psychosomatic Society did a study on university students where they gave them a so-called originator product to decrease their exam anxiety. And the students reported fantastic results. They said it's very effective. They can definitely feel the effect. And they then halfway through switched them over to a generic product. And all of a sudden they said that it's not working as well anymore. There are several negative side effects. And the clincher is that both of these products were placebos. So they had no active ingredient.
Okay.
Just goes to show you.
It's all in the mind.
It's all in the mind.
But let's talk about this. I mean, we're talking about patents earlier on, and I'm sure a lot of people don't understand how patenting actually works in the country, which is why some of us have to use generic medications. Let's talk a bit about that.
Definitely, yes. So if you think about brand name companies or originator companies, they invest a lot into research and development to bring new drugs to market. So it's fair for them to then patent that drug, because they need to be able to make the profits in order to cover further research and development. But once that patent expires, generic medicines enter the market to make it more affordable for consumers and also to drive natural competition, which naturally also brings down the cost of medicine.
Absolutely.
And that's why I think, the fact that a generic costs less has absolutely nothing to do with quality.
I was about to ask then, why do they cost less and people feel that, it's not working just as good as the branded one?
Exactly. It's absolutely just competition in the market. More products are entering, there's competition, there's more choice, and that naturally drives down the cost of a product.
So let's talk about that then. What are some of the options and, some of the benefits of switching to the generic medications instead of the branded patents?
Okay, so I wouldn't say that there are necessarily benefits in terms of health, because as I say, the generic medicine is bioequivalent. It's exactly the same.
Yeah.
But you do save money. You can save up to 80% if you move over to a generic drug. And, pharmacists actually by law are now obligated to offer patients a generic alternative where one is available.
And you just mentioned that. And of course, we wanted to find out more about some of the other benefits that could be derived from, of course, increasing the generic prescription. Do you think we're going to come across anything like that anytime soon, Nicole?
I think, it can have a massive impact on overall healthcare expenditure in the country. If doctors prescribe generics with more confidence, if they explain to their patients why they are prescribing a generic drug. So instead of saying, I'm switching you to the generic because it's cheaper, maybe go into the process, explain, that originator drugs are patented originally so that company can make back their profit, but a generic drug is bioequivalent, to make sure that patients understand that there is no difference in quality of medication, so that they don't have any imagined side effects when they do move over to a generic.
All
and
right.
then currently we're spending only about 40% of the 22 billion rand that South Africa spends on healthcare every year on generic medication. So there's a lot of scope for us to save, you know, if we can change the mindset for consumers and for healthcare practitioners to prescribe generic medication.
Absolutely. I mean, speaking of prescription there, Nicole, can a patient then say from the prescription that a doctor has given me, can I go to a pharmacist and say, can I get a generic version of this prescribed medication? Is that possible? And won't that get me into trouble with my physician then when I go back to him and tell him that I'm using the generic product?
Absolutely not. It's you definitely have the right to ask for a generic medication, and you should, because it can save you a lot of money. And when generics become available, they go through an extremely stringent approval process. Our Medicines Controls Council is really one. It's on par with the FDA and other approval agencies.
So they'll never put something that is not safe for the people to consume.
Definitely not. By the time our generics reach the market, you can really have a lot of confidence in taking that generic medication. And healthcare practitioners are also starting to prescribe more generic medication. They are starting to see the benefits for their patients. Ultimately, you do want holistic care for your patient.
Absolutely.
But if you can save your patient money without compromising the quality of treatment, it's a win-win situation.
Absolutely. Now, how do patients then teach themselves more about, the choice of generic products that they have, particularly for the ailments that they're suffering from, Nicole?
Yes. So you should be... not because it's a scheduled medicine.
Yeah.
You won't ever find people advertising medication. So it's difficult to really, educate yourself on the generics that are available.
Yes. That's what I thought.
Because it's not really out there in the public domain. But you can trust your pharmacist and you can trust your healthcare practitioner, and you can tell them, you're interested in a generic version. Would they mind running you through the versions that are available? And I mean, they can also tell you who manufactures the product.
Okay.
So if you, for instance, trust a specific supplier of medicine, a specific pharmaceutical company more than another company, you can say, I would like a generic version manufactured by this company. And if there is one available, your pharmacist will be obligated to give it to you.
All right. And won't this affect my medical aid in any kind of way if I'm switching to less? Is it going to give me more money? Am I going to have a bigger balance in my medical fund? What's going to happen there? Any effect?
Could potentially. So
that's another benefit.
But moving to generics, obviously it's a money saver.
Absolutely.
And generics you'll find on a lot of the medical aid formularies.
Okay.
So you won't necessarily then have to pay extra if you take the generic option.
So they do recommend the medical aids that you actually opt for a generic
where it's available, yes. So as soon as a generic will come to market, they'll start to reshuffle that formulary, and they'll always have the best quality at the most affordable price for their patients.
All right. So give our patients and some of our viewers some advice there, Nicole. If they get a prescription, what should they tell to their pharmacist when they go collect that prescription?
So firstly, when you're in the doctor's office, consulting with the doctor, you can say, doctor, what do you think is the best generic alternative for me? Is a generic available? And it's really completely fine to ask your doctor for a generic alternative.
Okay.
And again, when you go to your pharmacist, your doctor's prescribed a generic, and he just explains to you which generics are available on the market, and then you can, take it from there. And you can save, like I say, up to 80% on your...
That's a lot of money.
On your medicine.
Nicole, thank you so much for those good news. I mean, we have to save. We know that the country is currently going through a downgrade.
Absolutely.
So we have to make every little cent go very farther. Thank you so much to Nicole. That was Miss Nicole Jennings, the spokesperson of Pharma Dynamics, talking to us about the benefits of switching to or using or opting for generic medications. Your sports news.